Hello Pharma guys, welcome to my channel Easy Learn Pharma. So today I am going to discuss about a new chapter, a very interesting chapter. That's name is the prescription. So what is that name? Now the prescription. Okay. So what is the name? And the prescription. So the prescription, as a pharmacist, definitely you should know what is the prescription, because and definitely as a pharmacist you should learn regarding the prescription. So what is prescription? So before going to the chapter of the prescription, first of all, I am giving one example so that you can easily understand what I am telling regarding the prescription. Okay, suppose a person having suffering from fever. Suppose a person having suffering from fever, and definitely that person will come to the hospital for that treatment. You should know, definitely that person will come to the hospital for that treatment, will come to the hospital for that treatment. Okay, then after reaching to the hospital, the person or the patient will directly meet to the physician. So who is the physician? And doctor is the physician or doctor, or you can say RMP, that is registered medical practitioner. Clear? Then after reaching the hospital, the person or the patient will meet to the physician or a doctor or registered medical practitioner. Clear? Then the physician asks to the patient, what is your name? Tumhar name kaun hai? What is your name? Then what is your age? And what is your sex? And what is your address? That means where are you from? Clear? The physician asks to the patient, what is your name? What is your age? What is your sex? And what is your address? Okay, so then the physician again asks the patient, what are the symptoms occurs in your body? Tama body re what type of symptoms create house? Please tell me. Okay, then according to the symptoms, or after listening the symptoms or according to the symptoms, the physician prescribe the medicine with their proper quantities. Okay, with the proper quantities, or in which time you have to administer, or how many times you have to administer, or how much dose you have to administer. So, okay, that may be after food or that may be before food. So all the information are written or write in a form, and that form is called known as prescription form. Clear? So that form is called known as prescription form. Okay, clear? Then after receiving the prescription, okay, then the patient receive the prescription from the physician and will go to the medicine store Okay, so why the patient will go to the medicine store? Now for taking the medicines for the treatment. Yes or no? Achha. So those medicines prescribed by the physician, that medicine to the patient or to the pharmacist. Okay, now clearly those medicines prescribed by the physician, that medicine, that information to the pharmacist. So what do you mean by pharmacist, or who is the pharmacist? Now those persons present inside the medicine store, that's called as the pharmacist. Clear? So the physician, those medicines are prescribed by the physician, and that information directly to the or direction to the pharmacist, because a patient don't know regarding the rational use of drugs or regarding handwriting of the and doctors. Okay, Achha. So that's why that medicine directly to the pharmacist. So the physician, or sorry, so the patient after receiving the prescription will go to the medicine store and give the prescription to the pharmacist. Clear? Then in that time, the pharmacist receive the prescriptions from the patient and compounding and dispensing the particular medicine or the specific medication to the particular patient. So the total format is called known as the prescription. So again, I am repeating what is the definition of the prescription, or what do you mean by prescription. Now first thing you can say, the prescription is a written order form. Okay, because that is written by the physician. So the prescription is a written order form, clear, from a registered medical practitioner or the physician or the doctor, okay, from a registered medical practitioner to the pharmacist, not to patient, to the pharmacist for the patient. Okay, so again the prescription is the written order form from a registered medical practitioner to the pharmacist. Okay, for which purpose? Now for compounding, for compounding and dispensing, for compounding and dispensing a specific medication to the patient. Okay, so that is the complete definition of the prescription. So again, in that point, a question will be arise, sir, what do you mean by compounding? So what is the compounding? Now compounding means in the medicine store, the preparation, okay, the prepare the medicines, that is the compounding. So what do you mean by dispensing? Now those medicines give to the patients by the pharmacist, that is the dispensing. Clear? जो medicines ସବୁ ସେ patient को ଦଉଛି, that is the dispense to the medicines, sorry, they dispense the medicine to the patients, and compounding means preparation of the medicines inside the medicine store. Okay, so जो compounding word ଟି कौन ना आगुरु कौन होतिला ना हमर जो मेडिसिन सब आसुची, so आगुरु से different compound बा different molecules से आसुथला. So that's why the pharmacist, in that time the pharmacist collect the molecules from the different cells or different drugs and prepare the medicines, and that medicines enclosed in a packet. So that is the compounding. So compounding means preparation of medicines inside the medicine store and dispense the medicine to the particular patient. So that is the prescription. Clear? And again, that prescription includes that prescription includes name of the medicine, okay, and their proper quantities or route of administration, and dose, that quantities, okay, and frequency. Okay, so in the prescription, the name of it includes the name of the medicines, their proper quantities, their route of administrations, and their frequency. That means what are the medicines, the proper quantities, that means how much amount or how much dose you have to administer in a day, that may be before food or that may be after food, or that in which route you have to administer such type of medicines. So all the information is present inside the prescription. Clear? Okay. Next, and will be mark, okay, तमने mark करिथिबो prescription रे कोन हुए ना maximum time 99% doctors when prescribe the medicines, in that time they will or they are used some abbreviation or form or some short form, okay, or some Latin words. Okay, so simply we can say the physician when they prescribe the medicine, in that time they use some Latin words or some abbreviation or some short forms. So why the physician use the Latin terms or use the abbreviation or use some short forms? Now because in order to save time को ସେମାନେ save କରିବା ପାଇଁ ସେମାନେ କଣ କରନ୍ତି ନା sometimes Latin word use କରନ୍ତି, some abbreviation use କରନ୍ତି, ଆଉ କିଛି short form use କରନ୍ତି. Okay, so abbreviation means what? Now as for example, I am giving one example, that is BID. Okay, one mark କରିଥିବ ଗୋଟେ mention ହେଇଛି कि paracetamol 500 mg, okay, BID, or देखो PCM, that means paracetamol, that is short form of PCM. Okay, paracetamol 500 mg, BID means bis in die, bis in die means that is the twice a day. That means you have to administer the dose or you have to administer the drug 2 times a day. दिनू तमे 2 थर नहीं परिबो. Okay, that is देखो लिखा है और AF, that is after food खाई सरला परे. Okay, and the 0 by 0 लिखा है, that means you can say easily कि सकाळे गोटे राति की गोटे. Clear? So ये हो जाएगा sorry ये जो BID, so that is some abbreviation or you can say that is the abbreviation part. बुझिएला? अच्छा. So that is the complete definition of the prescription. So now come to the point. See what are the parts of prescription? That means in a prescription format. That means in a prescription format, there are so many parts are present. So what are the parts are present in the prescription format? And that is I will discuss one by one. So first one is date. First one is date, and second one is name, age, sex, and address of the patient. Address of the patient. And third one is superscription. Fourth one is inscription. And fifth one is subscription. And sixth one is renewal information or refill, and last one is sorry subscription after subscription, okay, sorry, subscription, then sig or signatura, then renewal information or refill, next signature of the RMP. Okay, so these are the parts of the prescription. So what are the first? What are the parts? Now, first one is date, and second one is name, age, sex, and address of the patient, and third one is superscription. Next one is the inscription. Next one is the subscription. Then it one is the sig or signatura, and then renewal information or refill information, and finally last one is the signature of the registered medical practitioner, or you can say that is the RMP. So these are the kind of parts of the prescription. So one by one I'll be discuss. So what are the parts, or what is the importance of the date? Why a date is mentioned in the prescription format? What is the importance of the date? Why the name, age, sex, and address of the patient are required before prescribing the medicine in a prescription? What is the importance of the name, age, sex, and the address of the patient? Now next, superscription. So what is the importance of the superscription, or what is the superscription? What is the superscription? Next one is the inscription. What is inscription, or what is the importance of inscription inside the prescription? Then what is subscription? Subscriptions mane kona? Okay. Next one is the sig or signatura. So what is sig or what is signatura? Then renewal information. What do you mean by renewal information, or what is the importance of the renewal information, or you can say refill. And last one is the signature of the registered medical practitioner.